Hi everyone. Today, me, Riya and my friend Dheeraj D'Souza will be presenting on the journal article The Intelligent Knife, IKnife and its Intraoperative Diagnostic Advantage for the Treatment of Cervical Disease. This article is a good example of mass spectrometry applications in surgery. The content of this presentation includes a bit about this journal article, a brief introduction, methods obtained, the results obtained, and a bit of discussion and future aspects related to the article. Just talking a bit about the journal article. This article was posted in PNAS, that is Proceedings of the National Academy of Science. The paper was initially approved on 14th February 2020 but was first published on 16th of March 2020. The impact factor of the journal is approximately 9, which implies that it is comparatively a good one. The main aim of this paper was to study the potential of IKnife, that is also known as REIMS, in enhancing the intraoperative management of cervical cancer during the surgical treatment. Lipid metabolism dysregulation is associated with many types of cancer and has been drastically detected by REIMS in different tissue types. The iKnife technology accurately discriminates cancer from normal tissue in different tumor sites including brain, breast, ovaries, and colon.
Hello everyone, I am Dheeraj D'Souza and I'm going to talk about materials and methods and also discuss the results later on. You might be thinking what is iKnife or REIMS? REIMS stands for Rapid Evaporative Ionization Mass Spectrometry. It is one of the chemical analysis methods for the electrosurgery generated aerosols. As the name suggests, it allows direct characterization of biological tissue without the requirement of sample preparation or cleanup procedures in near real time. To understand this journal further, let's get an idea as to what is cervical cancer. Cervical cancer is one of the most common cancer after breast cancer in females. Young age group, that is from 25 to 35 years of age, are most vulnerable, especially those women who are sexually active. This cancer affects the quality of life and the sexual function of the body really drastically. The good thing about cervical cancer is that it can be diagnosed at early stages and are open to surgical treatments. Here are some of the treatment options. I would like to briefly explain on what methods were opted in this study. So initially, total of 103 patient samples were collected. These samples were collected from three different groups of women. First being the population with normal cervix, second being the population affected by human papilloma viruses with or without cervical interepithelial neoplasia, and the third one is the population that have cervical cancer. But among these 103 samples, 16 of them were excluded because of lack of identifiable epithelium, poor quality MS signal, consisted of necrotic tissue, etc. Finally, 87 patients were analyzed. The samples were diathermized using the modified electrosurgical handpiece, which was responsible for producing the aerosols. These aerosols were then transferred into the mass spectrometer using the Venturi air pump in the negative ion mode for the chemical analysis and producing the results in real time. The mass spectrometer was kept in the analysis mode during the processing of samples in order to identify any potential cross contamination. The histopathological diagnosis was performed, which recorded the area proximal to the diathermized tissue in the database. This divided our samples into different groups, that is normal, human papilloma viruses only, cervical interepithelial neoplasia, and cancer. The spectral differences between the groups were modeled with least absolute shrinkage and selection operator, which was followed by a linear discriminant analysis for classification to explain whether the IKnife could distinguish the different tissue types. Univariate analysis was also obtained during sample processing. An analysis of variance was used to analyze the difference among the malignant and healthy groups.
Here is the MS spectra resulted from IKnife analysis of benign and cancerous cervical biopsies. A and D represents benign and malignant uterine biopsy respectively, wherein IKnife burns are labeled as 1 through 3. Graph B and E shows the total ion chromatogram obtained during the sampling of the specimen with the IKnife in the equivalent tissue type for normal and cancer tissue respectively, and spectra C and F represents mass spectra obtained in negative ion mode from uterine cervical biopsies, showing the degree of variability in the peaks for different tissue types, that is normal and cancer tissues. The spectral B and E is the outcome of the burn. This figure represents the multivariate analysis done to identify the spectral differences between different population samples. It is shown that three groups were clearly separated using the linear discriminant analysis followed by least absolute shrinkage and selection operator. Green colored dots represents the normal cervical tissue, yellow dot represents the one affected by HPV, and finally the red dots represents the cancerous cervical tissue. The table represents the proportion of correct classification while comparing IKnife diagnosis to gold standard histology. The table represents the calculation of diagnostic accuracy parameters of individual paired comparison. The overall accuracy of IKnife for identifying abnormal samples, including HPV, CIN, and cancer from controls when compared to gold histology standard was 100%, 95% CI, that is 95.9 to 100%. With a sensitivity of 100%, that is 94.9 to 100, and specificity of 100%, that is 79.4 to 100. When we compared normal versus cancer, the accuracy was also 100%, which was 90.5 to 100, with sensitivity of 100, that is 83.9 to 100, and specificity of 100, that is 79.4 to 100. The comparison between normal versus HPV plus minus CIN had an overall accuracy of 100, that is 94.6 to 100, with a sensitivity of 100 as well, that was 92.9 to 100, and specificity of 100, that is 79.4 to 100. The final group compared was HPV plus minus CIN versus cancer, which showed 100% accuracy, that is 94.9 to 100% sensitivity, which lied 83.9 to 100, and also 100% specificity, that was 92.9 to 100. The increased relative intensity in cancerous tissue compared to the healthy tissue was observed by conducting univariate analysis using ANOVA. The left image represents the box plot of the top MZ peak contributing to class separation log2 fold change, based on the univariate analysis between normal and cancerous cervical tissue. The log2 fold changes are determined based on the median spectrum overall observations. The 12 significant and intense REIMS spectral peaks are shown with p-value less than 0.001 and q-value less than 0.001. And the right plot explains the p-values of the 12 significant peaks identified during the univariate analysis between normal and cancerous cervical tissue.
IKnife was able to successfully differentiate between healthy and malignant cervical tissue. Hence, it has the potential to be used as an accessory interoperative diagnostic tool due to its high sensitivity and specificity. IKnife also enhances the clearance of margins at excision in a surgery setting with high accuracy of real-time confirmation. IKnife drastically increases the overall survival rate by recognizing the tumor cells during exenterative surgery. Given the disruptive nature of the technique, histological assessment from the thermally ablated tissue is not possible. Despite encouraging findings, translation of the technique to clinical settings may be limited by current size and cost considerations. which would necessitate its use in centralized location within hospitals and operating theaters with controlled temperature due to the limited mobility of the equipment. Future refinement of the technology towards a smaller, more user friendly apparatus is achievable. Future larger research cohorts of in vivo samples are required to validate the technique. Future studies could also explore whether this technology could be used for management of cervical pre-invasive disease.